This is a warning. If you have back pain and your back pain is not getting better, you need to be aware of a condition called the Degenerative Cascade. The Degenerative Cascade is where the spine progressively gets weaker and breaks down over time. I'm going to talk to you about that because if you have back pain that's not going away, you need to solve your problem so you can avoid the Degenerative Cascade. As you know, I suffered with a pretty severe back problem for probably 10 years. And my condition at the time was the result of an injury that I had progressed into the Degenerative Cascade. This is my spine. One vertebrae on top of the other with the disc in between. You can see this disc down here is very thin. What happened is I jumped off a cliff and from 85 feet into water and I smashed my back. And what I did is I squashed my vertebrae, but over time, it broke down. I eventually found a way out. I suffered with herniated discs, bulging discs, degenerated disc, which is part of the Degenerative Cascade. And this was probably taken 10 years ago. So I was very young at the time. And I had degenerated discs, stenosis, sciatica, end plate changes. And over the 25-year period since I had this injury, because it happened, actually, it was 30 years ago, 31 years ago, but we started treating back pain 25 years ago. And during that time, we've developed a 10-step process to help you eliminate your back problems. And to understand the Degenerative Cascade, you need to understand a little bit about the spine. Typical spine looks like this. The head's here, the hips are here. There's 24 vertebrae. In between the head and the hips, the vertebrae are the bones. In between each bone, there is a disc. The disc allows for motion of the vertebrae. Inside the spine is the spinal cord. The spine is designed to protect the spinal cord. There are little openings between each vertebrae called the foramen. It's through the foramen that the nerve exits directly off the spinal cord. So it's this area right here where the nerve exits. And sometimes what can happen is you can develop a problem in your spine that starts to aggravate and irritate that nerve. The problem is the longer you've had this breakdown of your spine, the worse it becomes. So the nerves in the neck go into the arms. Where's my pointer? The nerves in the neck go into the arms. The nerves in the low back go down the legs. If you've ever had a pinched nerve in your neck, very often you'll have pain in the neck. Sometimes you have pain in the shoulder. Sometimes pain all the way down the arm. Same thing in the low back. Pinched nerve in the low back. Very often you have pain in the low back. Sometimes you have pain in the hips. Sometimes you have pain that goes all the way down the leg into the foot. Now, to understand the Degenerative Cascade, you need to understand the disc. The disc is a lot like a jelly donut in the sense that the outside of the disc, there's a thick material called the annulus. Inside the disc, there's a jelly-like substance called the nucleus. The nucleus gives stability to the disc the same way air gives stability to your tire. Properly inflated tire is stable. Same thing, when the nucleus has a proper amount of fluid, it's stable. The nucleus is designed to distribute stresses evenly in all directions on the annulus. When the center of gravity goes right through the middle of the nucleus, the stresses are distributed evenly in all directions. That's important because when you change those loads and you change the compression pattern on the nucleus, you start to wear out the annulus, the thicker portion. This is a very thick cartilage, but under too much load, it will start to break down, part of that Degenerative Cascade. Now, the disc relies on blood to flow through the end plate of the vertebrae. And when the disc has too much pressure on it, the blood doesn't flow properly into the disc, and the disc starts to dry out. And the drying out of the disc is part of the Degenerative Cascade. Now, normal compressive loads through the center of the spine distribute stresses evenly in all directions. But what can happen is the load can change from an old injury, from sitting, from bending, from everyday life activities will cause the load to change on the disc. The distribution of the compression very often will force the annulus in one direction. and the nucleus, force the nucleus in that direction, it'll start to cause a little bit of a tear of the annulus. So the nucleus is pushing one way and the annulus will start to tear. Now, as it starts to tear, there's an inflammatory process that takes place. And that inflammatory process very often will cause you pain. But as it tears, what happens is the nucleus starts to push out. As the nucleus starts to push out, you'll develop what's called a bulging disc. Nucleus is pushing out a little bit, causing the disc to bulge. As it tears further, as you get more tearing of the annulus, the nucleus pushes out further. That's called the herniated disc. As it pushes out, you get some tearing, causes a lot of pain. But that herniation will start to compromise the nerve. So if you have sciatica, very often you have a disc problem pinching the nerves. Now, technically, there's 5 different reasons you can have sciatica. One of them is the bulging disc. The next one is the herniated disc. Now, technically, these 3 pictures are all herniated discs. Sometimes the nucleus stays inside the annulus. Sometimes it tears through. We call that extrusion. These tend to be a little bit more painful, and very often the nucleus will start to pinch and aggravate the nerve. And the nucleus is highly inflammatory, so when it hits the nerve, it creates a lot of inflammation. They say it's like battery acid on the nerve. You get a lot of irritation to the nerve, so this tends to be more painful, but they're all sort of treated the same way. But this is the extrusion. Sometimes what happens is the nucleus comes out of the outside and breaks off and starts to move up and down just a little bit. That's called sequestration. Now you can physically see it on an MRI. That's the important part. Again, what happens is you get the nucleus, the nucleus will push out and start to aggravate those nerves, causing the sciatica. Bulging disc, herniated disc. Now, once this process starts, you'll develop what's called the degenerative cascade. Now, we talked about the tearing of the annulus. When the annulus tears, there's inflammation that develops. And the inflammation causes pain, but the inflammation perpetuates the breakdown process. Typically, there are 3 biomarkers of inflammation from the disc. These are biomarkers for any inflammation, but these are the ones specifically when the disc starts to break down. C-reactive protein, IL-6 and PGE2, prostaglandin E2, interleukin 6. So when you have the inflammatory process inside the spine, that starts to perpetuate the degeneration of the disc. So in my case, this is what we call the degenerative cascade. I jumped off a cliff. When I jumped off a cliff, I smashed my back. I had pain. Okay, it doesn't always have to be that traumatic, but in my case, it was pretty traumatic. And then with that pain, I get some muscles that get a little bit tighter around the joint to hold it, to prevent it from getting worse. It's called immobilization. And then what happens is one muscle gets tight, one muscle gets weak. When one muscle is tight for too long, the muscle that does the opposite activity gets a little bit weak. Works like this in the spine. These muscles get tight, these muscles get weak. It's called reciprocal inhibition. It's what allows joints to move. Over time, that can become altered reciprocal inhibition. Tight muscles start to compress the joints. And you start to compress the joint, it changes the load on the disc. You change the load on the disc starts to push out. So part of what you have to do to solve this is make sure the joints are moving properly. But you also need to make sure the muscles are in balance. When the muscles are out of balance, you start to have bigger problems. So you get shrinking of the capsule, which increases the pressure. It does 2 things. It forces pressure on the annulus, but decreases flow of oxygen and nutrients in and out of the disc. So you decrease the flow of oxygen and nutrients in and out of the disc, you increase the inflammation, the disc starts to degenerate. This is the degenerative cascade. The longer you have it, the more it breaks down. If it's unstable, it'll continue to break down. That's the degenerative cascade. So it starts to go. Okay? I jumped off a cliff, I had the pain, it started. Now every time I would do something thereafter and I would aggravate the disc by moving into positions that make it worse and aggravate it, which is why we have the tips, by the way, Tips are very, very, very important because what they do is they prevent you from aggravating it. But the longer I had this, and I had it for 10 years, the more my disc broke down. And that is what happens, is you get a breakdown of the disc. Healthy nucleus looks like this. Proper flow of oxygen and nutrients in and out of the disc looks like this. Again, the blood flows across the end plate. Compressive load on the disc decrease the flow. Looks like this. These two discs are degenerating. How do we know that? Because there's less fluid in the nucleus. This is part of the degenerative cascade. Why is it a problem? Because the longer you've had it, the more difficult it is to treat it, but also it just gets worse as you get older because it develops what's called stenosis. So this degenerated disc, in this case, is bulging. Down here it's herniated. Okay, the nucleus is migrated through the outer portion of the annulus, part of the degenerative cascade. This is what it looks like in real life. This is a healthy disc. Spinal cord's in the back. You can see what happened over time is that disc broke down. Okay, vertebrae get closer together. What happens when the vertebrae get closer together? The opening where the nerve comes out gets smaller. That's another reason you can have sciatica. It's the degenerated disc. Why is it degenerating? It's degenerating because it's unstable. It's not functioning the way it should. And you've had an inflammatory process taking place inside the disc for an extended period of time. And then also what happens is you start to develop arthritis. Not everybody's going to have arthritis in their spine, but if you've had a lot of back injuries that are not resolved and the pain gets worse, or pain comes and goes and is never really going away, you have the degenerative cascade. We just had a study published on a patient, her name was Carmelita. If you haven't seen it, you have to access it. Maybe I'll do a video about her tomorrow because she had this degenerative cascade. And eventually what happened is you got to the point where she used to get chiropractic treatment, physical therapy treatment, she'd feel better, got to the point where it wasn't getting her better because this was continuing to get worse. So she ended up having a fusion, and the fusion didn't help. So we'll talk about her tomorrow. Uh-oh, battery just went out. So this is the degenerative cascade. But what happens over time is you start to develop a little arthritis on the back end of the joint. And that arthritis can also aggravate the nerve. It's part of the stenosis. As this disc degenerates, the space in the back gets smaller. That's called stenosis. We can solve this problem. You need to solve this problem. We have tips. We have nutritional supplements that help solve this problem. If you can't come see us, we have an exercise program you can do. If you can't come see us, we have the ability to solve this problem in our clinic. We can solve it even in the most advanced cases. This one's pretty advanced. Massive herniated disc. Okay, back to normal. Prevent the degenerative cascade and get your life back. Feel good and make sure you live for a lifetime. Now this patient here, okay, went through the program, pain went away. Same thing with Carmelita. Part of the study, she came in 10 years ago. We did a follow-up with her 10 years later. She has no pain. And in fact, it wasn't that long ago. I saw her on the internet, on Facebook. She was doing deadlifts. Deadlift is like the worst thing you can do, okay? But she had no pain. She's 55 years old. So we have the ability to solve the problem in the disc. When the disc breaks down, it's the degenerative cascade. It's inevitable if you don't stop it. If you have back pain and you want to come see us, call this number, 844-577-7329. I don't know why my light went out, but my light went out and I'll prevent it from happening. That's it. So if you have any questions, put a comment. I want you to like, I want you to share, and I want you to comment. That's it. Thank you, and have a good night.